going to introduce yourself. You're going to check to make sure who the patient is. Just the same thing we've done all along, okay? And at the same time, we're then going to start, we can talk to her. You can then, at that point, say, do you know why you're here today? So you can get that information. You don't have to say, what's your name, date of birth? You could just ask some questions that give you that idea. So then I would probably next do my vital signs. I'm not going to do those, but we're going to do a temperature, heart rate, respirations, blood pressure, O2 sat, and I'm going to ask her if you're in any pain today.
No pain.
Okay. Now what I usually like to do is I'm going to have her sit up on the side of the bed.
And when you have your patients...
I can give you my flashlight.
Okay. So what I would probably do now is I would start from the head, and I would say, I'm going to then go ahead and look at her eyes. I'm going to say that her pupils are about a 4, and then all I'm going to do is this time is I'm just going to see if they react to light. That's all I'm going to do, okay? So I've got that much done. I'm going to go in here and look at her mouth. Everything looks good for me, okay? If you don't mind, I'm going to have you push your head against my hand. Push your head against my hand again. I'm going to, I probably did this in a little bad order, but you can fix it up. And I'm going to say, follow my finger with your eyes. Okay, so I've done the extraocular muscles. Did I say to raise your shoulders? Don't let me push them down. Bring out your arms. Don't let me push them down. Don't let me push them up. So I've done range of motion at the same time, right? I've done strength. And then I'm going to feel for her pulses because I'm here at her hands. I'm feeling her temperature. Okay? And then I'm going to say, squeeze my fingers. Okay, good. Coming down to her fingers, I'm going to say she's got good capillary refill of less than 3. Could you put your fingers together like this? And I only need to check one because if one's clubbed, they're all clubbed.
Yeah.
You don't have to say do each and every one.
Same with capillary refill.
You don't have to do it. They're all going to be the same. So now I've done skin. I've noticed that she's got freckles. Okay, papulas. Okay. Then I'm going to come down a little bit further, and I'm going to say push your hands against my leg, and your legs against my hands. Do the same thing. Now, I would, if I was a nurse practitioner, do reflexes, but we're not going to do those because we're not asking to. But I would come down and I would check for her pedal pulses. And they're +2, +2. I'm looking at her legs.
Hairy legs. I didn't shave. Sorry.
Okay. So now I've done all
But I have good circulation, right?
Hey, there you go. There you go.
So now I've looked at all of her legs, right? Okay, now I'm going to go ahead and I'm at the chest here. So the next thing I would probably do is go ahead and I'm at the second intercostal space. I'm going to do aortic.
Would we have them lay down or stay sitting up for all this?
He doesn't have to.
Okay.
You can do this sitting up or lying
But
down.
if we wanted to auscultate all the way down, like chest, heart, abdomen, then...
No, I'm going to have them lay down for the abdomen.
Okay.
Okay. So I'm going to listen to the apical.
And she would be
At the
sticking
second-
that in here.
Yep. Sorry about that.
That's okay.
That's
That's one of my pet peeves.
Pet peeves are we always like to go to the skin. And we listen to the apical, the pulmonic. And then I'm going to drop down to the third intercostal space. And that's my herbs.
Then she has to come up
And
underneath.
I'm coming up under, and I'm at her fourth intercostal space, tricuspid. And then, could you raise up your breast for me, please? Thank you.
Unless you may have to do this.
And then I would say S1 is louder. Where?
The bottom.
Okay, and then at the top. And the top.
Don't say at the bottom.
Tricuspid space.
Thank you.
Okay. So I've done her heart. Now I'm going to do her lungs. Do the same kind of thing. I'll listen to her lungs. And if I can't hear anything, I'll ask her to take deeper breaths, but I can hear just fine, so I don't have to go any further than that. Come down here. And here. And I'm going to do underneath here. I might ask her to raise her, I can hear just fine.
Oh,
So then I come around to the back.
if they're wearing a gown, is their whole bottom going to be exposed while
You
we're
can
doing
raise
it?
right
They have
up underneath.
underwear on.
They have underwear on.
You'll have to
And I'm
drop
going
from the
to, you
side.
see how I'm coming down, I'm not going over, I'm going underneath here. So now I'm going to listen here. And over here. I can go down one more. Another one. Then it's best for me to come up again.
Hyperventilating.
Then I'm going to come over here to the side. I usually do both of them here on the side. And then I come over here to the other side.
Do you like note anything like I hear great breath
I would say after this that bilateral breath sounds are cleared to auscultations. There's no abdominal
Anterior and posteriorly?
Yeah. There's no nasal flaring, no increased work of breathing. Okay, then I'm going to ask her to lay down. You're going to take this. I'm taking this.
That's grossing you out, it's
grossing me out.
What is it?
It's a pelvis thing. That's why I said don't spread any rumors about me.
And now, why am I going over here to the right side? Because they always tell you to do the right side first, right? Okay. So I'm going to just listen.
I will tell you, make sure when you're examining the patient, like if you have them sitting toward the window so we can see what you're doing.
Okay.
That's fine.
Okay?
Okay, so then I would listen to her bowel sounds. I always start with the non-tender. She doesn't have any pain. She told me that in the very beginning, so I don't really have to worry about that. But I'd start in the left, of the right lower quadrant, and go up to the right upper quadrant, and go up to the left upper quadrant, and down the left lower quadrant. So I hear bowel sounds are positive in all 4 quadrants. Then the next thing I would do is start palpating. Okay, so I'm palpating. Do you feel any pain when I palpate?
No, fine.
Okay, all 4 quadrants, there's no pain on palpation. And because this is not an abdominal, any more than an abdominal assessment, tell me what's next on that list.
So you need to check for a hernia too.
Oh, yeah. Thank you. So I'd say, can you raise up your head a little bit and make a crunch? Okay, and I don't see any bulging, so there's no hernia. I'm sorry.
It says to palpate the thorax for crepitus too. Do you want us to do that?
Yeah, probably. It wouldn't, you know.
Aren't you going to check the abdominal skin too while you're...
And while I was in there, I was going to check my abdominal skin. So I'm going to do that abdominal assessment. And then if I didn't feel like I got down to my legs, I could still get down here because she's down, and I could check her toes for clubbing and for calf refill and everything else. But I could have done it when she's sitting up too, because she's not going to have any shoes or socks on. But you see how fast you really can do it? And I covered everything. I did radial pulses, pedal pulses.
And same thing for edema while you're down there too.
When I'm down there for edema, I did all that when I went down there and looked at all that. She had good, she has good hair.
And just like Mary Jo kind of forgot something, if you guys get to the end and we think you've forgotten something, we'll say, go ahead and check something else on the chest, or isn't there something else you want to do with the abdomen or whatever.
And my problem is that I'm trying to take away the things that I normally do that you guys don't do. So that's why I'm having
Yeah, your
trouble.
checkoff is actually very abbreviated.
Yeah, very abbreviated. So go through just very...
You can do all those things.
Do you
Just
see
get
how
organized.
quickly that went through? Where it flowed.
And it was head to toe.
And I'm not even...
Is it wrong for like I mean I don't really